Отже, Іване, слава Ісусу Христу.
Слава навіки.
Дорогі ті, що дивляться, those who are watching us or will be watching us, and to those who perhaps review it after it had been recorded, I just wanted to welcome John Holuk into our conversation tonight, and talking about timely topic of church reopening. I invited John Holuk for the reason that he's probably the most qualified specialist to provide an advice on protocols, how to build the protocols to reopen the churches. And also he had prepared a nice presentation about what is required, what is needed, and will be answering the questions after he finishes his presentation. I am asking you to please pose the questions, and once the presentation is over, I guess, Ivana, you'll be able to answer those questions.
Sounds good.
Yep. Okay, and we're praying to internet gods that they will
we won't freeze.
That they will not leave us at this point of time. Окей. Але так як кожного разу ми почнемо сьогодні так само із молитви. Ім'я Отця і Сина Святого Духа, амінь. Ім'я Отця і Сина Святого Духа, амінь. Ім'я Отця і Сина Святого Духа, амінь. Царю Небесний, утішителю душі істини, що всюди єси і все наповняєш, скарби добра і життя подателю, прийди і вселися в нас, і очисти нас від усякої скверни, спаси благі душі наші. Слава Отцю і Сину Святому Духу, нині повсякчас, і на віки вічні. Амінь. Господи, прийди, благослови нас, осіни нас Твоєю мудрістю, що ми все, що ми творили, було Тобі на славу, а нам на спасіння. Амінь. Отже, Іване, without any further ado, I would, before I'll manipulate into that presentation being put on a big screen, I would actually ask you to say a couple words about yourself so people kind of more or less familiar. I know Ivan because his lovely mother was a good friend of mine, and she was my parishioner, and through her I was able to meet Ivan and Kathy and Irena, her children. So Ivan is truly a very unique specialist, had spent most of his professional career doing what is now necessary to do. Прошу вас, Iván, if you can just say a couple words about yourself.
Good evening, dobry вечер. Just a couple of words. I grew up in Ottawa and attended the cathedral there. I got my education at the University of Toronto, degrees in chemistry and biochemistry. Joined a major oil company, and I spent the last 20 years as a principal consultant, helping companies with their operational improvement, health and safety management plans, looking for ways to find out how they can improve, address gaps, and keep everybody safe and efficient in their work duties. When I retired, 4 years I spent coordinating our humanitarian efforts for Ukraine with UCC. And then about a year ago, I became aware of some challenges some of our care homes were having. There were 2 Ukrainian senior homes in Toronto at a time when everybody was scrambling for personal protective equipment. So I offered to help and sourced some supplies, and through that also began to learn of challenges that our clergy were facing when they had to be confronted with delivering last rites to COVID patients, and concerns about the safety and how to go about that. And that grew into work I've been doing for the last 8 months with the Cathedral and Cultural Center in Oakville to put together their safety plan and procedures and make sure that our liturgies, our operations there are safe in this terrible pandemic.
Thank you. Дякую, Іван. I don't want to further ado. I just wanted to say that most of our presentation will be done in English. If you have any questions, please do not hesitate to type in the questions, and Ivan will be able to answer them after the presentation is over. Right now, we'll be, like I said, manipulating our virtual gods to allow us to have a multimedia presentation on the screen, and Ivan will be commenting on it. Okay. I will be gone from the screen to allow it larger picture to be there.
Great. And if you could enlarge it further, Rakats, if you could. The presentation. But that's the presentation's not on the screen.
My apologies, technical difficulties. I'm trying to decipher how to do that. Okay, so it's on the screen right now. Okay. And I'm hiding, and I'll be hearing your voice, and you'll tell me when to switch to the other slide.
If we can go to the beginning slide as well, and I'll start. Thanks. Without any further ado, thank you for joining us tonight. Hopefully, in the next half hour to 40 minutes, we'll have an opportunity to share some learnings from the Toronto Oakville area with you, answer your questions. I'd like to really focus on three areas. One, providing a status update on COVID and the current situation and impact in the Greater Toronto Area and Ontario. I would like to then talk a little bit about the expectations, the continually changing guidelines from public health and governments. For those of you that have been involved in working in your own parish, you know that at the height of the crisis, some of these guidelines have changed several times a week. A real challenge navigating through all of the documents. So hopefully I can work through that and simplify or at least clarify things for you. And then what I'd like to do is go through the process of preparing for reopening and sharing some of the experiences we've had in Toronto and Oakville with our reopening and our planned opening again. Next slide, please. I thought I'd start first with a comment about the current situation. And I've learned over the last week or two that the current is a very flexible term, as the chart that I'm showing you has already changed over the last week. But in Ontario and some of our major regions, we've had some very positive declining numbers in cases in Ontario, Toronto, down to 300 and 400 range, Halton, 40 down to 20 a day, which is excellent. And Ottawa has been ranging in 30 to 70 by comparison. If we look at the timeline, I think many of you have followed a similar path, preparing to open the cathedral after the initial shutdown in June and July, finally opening the churches, and then shortly thereafter, unfortunately, having to suspend liturgy again as the cases started to skyrocket. And they peaked at the end of December and prompted the lockdown and the stay-at-home order in Ontario. And fortunately, the case numbers dropped dramatically, but as I suggested, things can change quickly. And over the last week, that beautiful curve that's heading downward has started to turn up in the other direction, which is a concern. Some of the other metrics that are being watched, the testing capacity and turnaround is being improved dramatically. I think with 95% certainty now, you can get a COVID test within 2 days. Community spread is slowing. In Ottawa, it was stable, and unfortunately, as a result of results today, it seems to be stabilizing as opposed to improving in Toronto and Halton as well. And in general, the hospital and public health unit capacities to handle the current case numbers are also improving. Next slide, Otets. So one of the things that I thought would be worthwhile spending a few moments on is the response framework, the color-coded approach that Ontario has used to define certain levels of restrictions depending on the caseload and other factors that are being monitored. And the things that they look at on a daily and weekly basis are the cases per 100,000 population, the percentage of COVID tests that come back positive, an assessment as to whether there's increasing or decreasing spread, and that's really based on one case infecting more or less than one person in the community. A large number of outbreaks were taking place. That's decreased, but they're monitoring that. Hospital capacity was at risk of being overwhelmed in January and has improved. And public health unit capacity, that is the ability of our health network to manage and do contact tracing. When someone tests positive, there's a process that goes on, very detailed investigation, who the individual was in contact with to try and help manage further spread. And typically, it takes 10 to 14 days from a change to notice the impact. And that's very important. Already one region, Simcoe Muskoka, which was moved into the red zone 2 weeks ago, has seen a significant case increase, and they've moved to lockdown as well. So the government calls that an emergency break, and they will be monitoring the results for all of the regions. And if the results do not continue to trend downward, they will put people in lockdown again. And hopefully that's not going to happen. Next slide, please. Just wanted to share with you what that looks like for a number of regions. Toronto is still in lockdown and under a stay-at-home order, and this will take place and be in place until March the 9th. Halton, our numbers have been doing quite well, and we're in that red zone. What that allows is you can conduct services to a capacity of 30% of your facility. For Halton and the chapel, that is 35. And in Toronto, at the cathedral, that's a 40 max. Some of you have a cultural center or a banquet hall associated with your facility, with the church. And currently under the red zone, it's still limited to 10 people. So in essence, we're still shut down in terms of holding events. And the cemetery is also associated with our cultural center and chapel in Oakville. And the limits now have increased for funerals outside. In Ottawa, they moved to the orange zone. And essentially that enables them to host in the church hall events with a maximum now of 50 people indoors. Each region, depending on its performance, ended up in a different color zone, and it's monitored on a daily and weekly basis. One of the concerns worth noting, we hope that positive trend continues, but I'm sure you've all heard of the variants of concern from South Africa and the United Kingdom. They're more transmissible and possibly more severe in terms of the symptoms that result. And so that is a concern in that it may once again turn that curve from a positive direction upward. These viruses, the variants, are a priority for public health, and they're applying most of their resources to try and contain that. And over the last week or two, the tracking that's been done suggests that that virus is about 10 to 15% of the infections now, and by mid-March, that's anticipated to be the dominant strain. And already in Toronto, 8 schools have reported cases of the new variants. Now, with this new variant, many of the control measures that have been in place still apply. But the message is, don't let up. Please be diligent. They're looking at focusing on mask quality, improving mask quality, and ensuring good mask fit. When you wear a mask, the seal of the mask around the nose, the mouth, and the chin is absolutely critical to protect others and yourself. And it's up to the organization that's hosting an event, holding the service, to ensure that the individuals are wearing appropriate masks and they're fitting properly. Duration of contact is also a concern. They considered previously close contact to be 15 minutes. And the risks associated with contact less than that was less of a concern. With these new strains, they're now considering as little as 5 minutes to be close contact. So when we are together, safely distance and ensure the amount of time that we're in contact is also reduced. Proper ventilation in indoor facilities is also becoming more of a concern. Many of the educational institutions now have purchased portable air purifiers where they don't have an efficient ventilation system. That's becoming more important, and all of you, I'm sure, have heard of the tighter travel restrictions, not only international travel, but in Ontario, if you travel intraprovincially, you're still required to self-isolate for 14 days. Next slide. So back in the summertime when things were good, we had just recovered from the first wave, we were still learning about the virus, and more cases of spread or super spreading events came to the forefront. And this is an example back in August where there was one individual who walked into a church, and there were over 50 people that were directly infected or infected secondarily by this particular case, including families where a husband would infect the wife and their children, and the individual himself infected his family. So it's really important to realize that all it takes is one individual without proper precautions, and many people, many lives can be affected. And so if we go to the next slide, it can happen to us, and it has. Since November, we've become aware of a number of individuals testing positive, becoming ill, infecting others, and being hospitalized, and in one case, dying. And these individuals are clergy from different parishes, staff and volunteers, parishioners, contractors. Many of your churches, your halls have people coming in to do maintenance, repairs, sometimes a little more detailed construction. They enter your facility, the church. They're at large in the community. They're working on different projects, and we've seen infections come from a contractor. Also, on a personal level, extended family and friends. Up until November, it was very quiet. I didn't know many people who had actually tested positive or become ill. But since November and during that peak, there are at least 15 or 20 people, extended family that I personally know, have been affected by COVID. It will happen, and it's also important to remember some of the challenges in protecting yourself from COVID. Over 40% of those with COVID are asymptomatic, so they don't have symptoms. They may not know they're ill. Individuals are contagious 48 hours before symptoms show up. So again, they have no symptoms, they're not aware they're ill. And then it takes 4 to 6 days for the symptoms to materialize, and 4 to 6 days for enough virus to build up into your body so that you will actually test positive if you do take a COVID test. Many people can be contacted during those 4 to 6 days. So it's absolutely key that we protect ourselves and assume that everyone could be positive entering the church. Because someone is a nice guy or a friend, if they're active and moving around in the community, there is a risk. A significant proportion of individuals who test positive do not want to share with public health officials who they were in contact with or where they were. And that makes the contact tracing part very difficult. So protective protocols that have been in place at our church, our cultural centers, we can say for sure that it's protected individuals and prevented transmission. Next slide, please. So that's really the current status. What I wanted to talk to now are the pages and pages of regulations and requirements that have evolved over the last 8 months. I think early on in March and April, it was very clear that public health authorities were learning and everyone was trying to figure out what the virus was all about, what we needed to do to protect ourselves and others. And so there were a number of organizations that are really involved in this in Ontario. Firstly, the Ukrainian Orthodox Church in Canada provided some initial guidance, I believe it was out in June, a checklist of how to approach the reopening of churches and what to consider. The Ontario government really is responsible for emergency legislation and laws, regulations, and they were the ones that introduced the COVID color-coded framework. Ontario Ministry of Health and the Chief Medical Officer, they've provided sector guidance to different types of businesses, restaurants, places of worship, schools, and specific activity guidance on what you can do, what you should not do. Early on, they prohibited singing, they prohibited use of holy water, and over time, as they learned, and we learned together, they allowed us to adapt our rituals, our practices, as long as they were conducted in a certain way and conducted safely. From those guidelines, and I've put 4 or 5 examples of public health guidelines from Toronto, Halton, and Ottawa for churches and places of worship. These guidelines each are about 8 to 10 pages long, sometimes with multiple links, but they provide some detailed guidance on what we're expected to do to ensure we protect our staff, our clergy, but also parishioners and members of the public that are entering our church and our cultural centers. And one of the key aspects of that, as of November 30th, each business or organization should have a safety plan in place, which details the policies and procedures that you have to protect everyone at the church. And the regulations and guidelines are continually updated, and it's important to monitor these and be aware of changes so they can be implemented at your church. Next slide, please. So how to build a safety plan. We started this process back in June and July, and we developed separate ones for the Cultural Center and the Chapel in Oakville and the Cathedral in Toronto, because there were enough different activities taking place that warranted that. It was very important to start off with some basic principles. Respecting the rituals and traditions of the church was paramount. Complying with public health regulation and guidelines was absolute. Non-compliance means significant fines, risk of being shut down. So that's non-negotiable. But above all, the key focus is to protect the health and safety of our clergy, staff, volunteers, and parishioners, everyone who enters. And when we make changes, we always ask the question, does that change make it safer, or are we increasing the risk? So in that process, there are a couple of things that you should consider. First and foremost, it's important to monitor the changing and emerging regulations. Things have quietened down dramatically now, but in the September to November period, these things were changing twice a week, 3 times a week, and it was very difficult to keep on top of that. Next, you need to consider all of the activities conducted within the church, but also outside of the church. And that's important because COVID doesn't live in the church. Someone brings COVID in. When we're within the church, we have to put measures in place that protect each other and protect spread. But if we look at the duties of our priests, they may be called on to deliver last rites to someone in a home or a hospital who's just passed away from COVID. And there's some significant risks that is taken through that process. And we need to help ensure that they're aware of the proper personal equipment they need and measures to keep them safe. And so that needs to be considered. If you look at the scenario where a priest perhaps has visited someone in a home as opposed to a hospital, a family is emotional. The level of controls that they have in a house don't match a hospital. So you're in an environment where infection may be possible. The same priest is then off to a funeral 2 days later or a baptism. And it's important that we look at all of these things to assess the risks, to make sure that no one is bringing in the infection to the church. And once in the church, we have measures to protect each other and ourselves from further transmission. And to do that, you then develop your policies and procedures and the documentation you need to support that. And finally, a key element is training and awareness, making sure that volunteers, staff, our priests, everyone understands why we have to do something and how those procedures are designed to help each other, not simply telling them that this has to be done. An understanding of why and how it protects us is absolutely critical. Next slide. So I didn't get all the spelling mistakes at that, but I wanted to provide you with an overview of the product that came out of our efforts in Toronto and Oakville as an example. So we developed policies and guidelines, and they cover things that are required by the Ontario government, such as a masking policy. Also, a policy for health screening. Toronto Public Health, the Ontario government requires you to have a screening process, screening for symptoms when individuals come in, filling out a health questionnaire. We also test the temperature of everyone coming in as an added measure. In addition to that, we have guidelines that we share with our parishioners, the rules basically when they come to attend a service. And then each different service, we have guidelines on how they should be conducted. Each one has its intricacies, and that also has a demand on volunteers. We use a general rule that for every 10 people that will attend, we need 1 volunteer. And those volunteers help maintain distance. They help register our parishioners, do the temperature checks, usher them to their seats. So again, there's good distance between them. But we've found painfully sometimes that using that as a guideline helps to ensure a smooth entry and minimizes any potential concerns. We've developed guidelines for contractors. so they know exactly what to expect when they arrive. We screen them, what PPE we expect. We also meet to understand their own policies and what their protocols are should one of their employees become ill on site or test positive. And that is essential to do ahead of time. It's always better to be proactive than react in the event of an incident. In Toronto, we also have a small food business titled Heavenly Pierogi, and they prepare food for takeout for the general public. And it's still part of our facility, and so we have to make sure that the appropriate control measures are there, and we comply not only with guidelines for places of worship, but then we have to look at restaurant guidelines and food services. So they have a separate set of guidelines. The procedures provide guidance on how you do things and why. And there are a number of procedures there. I'll just give you some examples. The recovery plan. What do we do if someone gets ill or if someone develops COVID when they're off site? What do we expect in terms of communication? What do we do in terms of cleaning and disinfection at the hall? Procurement. Many of you probably struggled, as did other facilities, obtaining PPE, protective equipment, in the early stages. And then when it became available, we learned of all of the counterfeit, fake masks that were being produced, or hand sanitizer that contained methanol and other chemicals that were actually harmful. So we've identified brands that are trustworthy, we've identified suppliers that are trustworthy, and we also check the site that the Health Canada has, where they list product recalls if there's a problem, or approved products and suppliers as well. That's built into our procedure. And all of the others really detail important parts of how we should do things on site. And the bottom one is a communication plan, but that is absolutely critical. Informing everyone of any changes, what's expected, and as much as possible, inform people ahead of time so there are no surprises, concerns, or even conflicts when they arrive at the church. Next slide, please. I thought I'd throw in an example from Toronto Public Health require a policy on masking. And that policy really describes what's expected when you're on site, who has to wear a mask, what kinds of masks, but they also expect you to be prepared for people who don't want to wear masks. And we've run into that a number of times, and we've provided guidance to our volunteers on how to deal with that. And we have information about the policy at the door, answer questions respectfully the best way we can. And also we look to our volunteers to work together if ever someone is unnecessarily rude or challenges the need to follow some of our procedures, which include masking, hand sanitization, and registration. And early on, as I'm sure many of you have encountered, that did happen, and that was unfortunate. Next slide. So I talked about a successful or reopening, and to do that successfully, there are a number of key elements that we learned the first time we reopened. And since we've been closed now in a stay-at-home order for several months, we'll be going through this again, refreshing everyone's memories, and make sure that we have everything we need in place. And it starts with your policies and procedures, and making sure they're not only there in a binder, but people understand why they're important. Resources are available and trained. Volunteers are always a challenge, and they do a valuable, important role. And it's important they also know the tasks that we ask them to do, whether it be to register, someone, they understand what they're supposed to do, and we provide support for them during that process. Make sure your equipment and supplies are in place. We hand out now face masks to anyone coming in that doesn't have a face mask, or we don't have respirators, but the surgical masks. If they don't fit properly, if they don't wear them properly, or someone walks in with a bandana, we provide them with a suitable mask that they can wear. Communication plan and signage. We have signage everywhere to highlight social distancing requirements, etc. I lost the presentation. And I'll just continue. I've got a mirror slide here, so I can at least talk to those elements. Yeah, the communication plan is critical, signage everywhere, but use the tools that you have, whether it's Facebook or Gmail, email blasts on a weekly basis, to keep everyone informed about what's happening, what people can expect when they come to liturgy. Active support and engagement of leadership, that's incredibly important. The executive at the church should lead by example. Belief in the procedures, the importance of the procedures, supporting and thanking volunteers for the work they do, absolutely critical, because it can be a very difficult time when our parishioners, unfortunately some of them, like to challenge everything that's done. The next thing is ongoing monitoring. It's important over time. We tend to relax, and that's a way of making sure there are no gaps, things that we've forgotten, and we find issues before they become a problem. So I'll just move to the next slide, but we still can't seem to see it on there. But one of the key things that we're involved in now is a readiness review. And Toronto Public Health has issued a checklist of the important things that you need to have in place so that you can be certain that your procedures and protocols are there and effective. So in February, they issued this safety checklist plan. And what you can do, depending on how far along the path you are to developing your own safety plan, this checklist, 5 pages of what's expected of you, can be used to develop your own safety plan. Early on, it was incredibly important to learn what's required. It was unfortunate that the public health authorities were learning at the same time and guidance was changing. But we're in a situation now where the guidance is clear. They've been able to consolidate their requirements, and it's much easier for our parishes with limited resources to put in place procedures and a safety plan that will help. So our next steps, right now we're reviewing our procedures and policies. We'll identify any gaps, and then we continually provide a weekly update to our executive on any changing recommendations or requirements from the various authorities. Just move on. The key control measures as part of your safety plan should be screening. Everyone that walks into the hall or the chapel or the cathedral needs to be screened using a health screening checklist. Have they traveled? Do they have any symptoms? I'm sure many of you are familiar with that. Next, all of the things you do to ensure physical distancing is maintained, the capacity limits, not only to your facility. Okay. Just received a note from Otets that the internet disappeared. So I'm hopeful that you can hear me. So the core measures are screening, physical distancing, wearing the masks properly, and the right types of masks. That can, in some cases, provide you 5 times more protection if you're wearing a proper quality mask and it seals properly. Hand hygiene, the use of sanitizer when people come in, before and after they handle things, very important. And we have a rigorous cleaning and disinfecting protocol, the regular cleaning that's done with our detergents and disinfectants, but hopefully we'll get the slides back. We've also purchased fogging units, and these units spray a mist of a food grade disinfectant, and what we do is proactively, weekly, do a preventative fogging of all areas of high contact and potential risk. So our slides are back now, but that's, if you can go to slide 13. Great. Right. So I talked about the core control measures, but we've also taken a lot of time to secure the equipment that's helpful. You'll see the touchless thermometer up top, N95 masks. We've had a look at activities, and on the basis of risk, decided what type of mask should be worn where. So if our priest ever has to go in to deliver last rites, they'll follow all of the procedures of the senior residents, but they always wear an N95 mask and a face shield. We have a room where we can have confession. There's a significant amount of room there, adequate room. We have a plexiglass barrier, and the priest would wear an N95 mask. So we try and understand the risk and then match it with the right personal protective equipment. And those pictures at the bottom, those are the fogging units that actually we can spray furniture, walls, washrooms, and it's a very effective way of sanitizing, disinfecting. In 20 minutes, it basically dries and dissipates, and is a really effective way of disinfecting an area that may be used more than once. A panachida scheduled an hour after a liturgy, or 2 events taking place in the hall. It's an extremely effective way of disinfecting. Next slide, please. So that is more the nitty-gritty of the safety plan, the controls. What I wanted to talk about is how we think about safety. And when we're involved in things that are not very risky, day-to-day things at home, there are approaches that probably are appropriate. When there's a risk of disease, infection, and ultimately death to vulnerable individuals, I think we need to change the way we think. And if you look, I'm not going to go through the entire list, but this was modeled after a safety culture presentation by some major companies that continually strive in high-risk environments to find ways to get people thinking about safety. So if we start on the left-hand side, I'm sure many of you have heard these comments when it comes to procedures. It's too bureaucratic, or it'll never happen to us. It's okay, nobody's watching, I'm just going to do it once and it'll be okay. All of those behaviors are really, really a problem. I debated whether using the word pathological, that's what that particular system uses, but it really is. It's asking for trouble, especially if there are hazards like COVID. You move slowly to the center, which is more of a reactive phase. You respond to things going wrong. You have procedures, but it's not quite ingrained. And the idea of moving from that exception culture on the left to a safety culture is that we don't need someone to tell us to do something. We don't need to go grab a procedure. We're always looking for ways to do things safer. When we investigate something when it goes wrong, we don't hide and get defensive. And I'm not going to say anything because I don't get into trouble. You investigate, you learn from what went wrong, and hopefully put in place the things that will protect you in the future. I'll give you an example. We had a contractor at the cathedral who tested positive. We learned 4 days after he was on site doing some work. There were some interesting learnings through that. A month earlier, our administrator had noticed that that individual was coming in to do his work. He registered, but he was wearing a bandana, even though their own company policies require them to wear an N95 mask. And so he was challenged, told our policies were to wear a mask. We provided a mask. He didn't have one at that time. A month later, this was the individual that tested positive. And he came in without symptoms. We registered him. Everyone was wearing their PPE. And we thought everything was fine. Interestingly, we do a preventative sanitization, fogging, on Saturday. So that whole area that was contacted was automatically sanitized. We didn't know until 3 days later that that individual had tested positive, but we had confidence that our people were at low risk when they registered, and we're also confident that the area had been totally sanitized and not putting other people at risk. So there's always much to learn when something doesn't go right. And you know, one other thing that I'll encourage you to do is think about this as a way to work together, but also communicate to parishioners, to people renting your hall, that we're doing our best to keep you safe. And that often can be an important factor in the decision-making process as to whether they want to rent the hall or whether they feel comfortable going to church. If we can go to the next slide, one final comment on that. The way you move from the left to the right, 3 key elements: leadership, personal leadership, as well as leadership from the executive, communication, and training. Next slide, sorry, Otats. So what can we do together to combat the virus? Well, there's tremendous amount of knowledge and information and resources that are available. The documents produced by the Ministry of Health or public health authorities are exceptional. I'm sure we have doctors, we have incredible resources within our community. Suppliers and service providers can also be of helpful information. For example, ventilation. What is good ventilation? Well, many of you have a supplier that maintains your system, understands the system, and can make some recommendations as to how to get the most out of your ventilation system in this environment. And don't be afraid to use students and retirees. They bring different experience that can help you in that process. The second thing is working together. And I felt that way when I was working with UCC and trying to help Ukraine. We had many organizations, many Ukrainian organizations, all seemingly working independently, doing it their way. And there was such a big challenge that it was really critical that in that time of need, we work together. And it's no different for COVID. And I'll give you 2 examples. We just learned this week that the OCC in Ontario provides grants for small businesses, specifically to help them with equipment, personal protective equipment driven by COVID. These grants are up to $5,000. And a way, I know everyone is struggling with funds. Our halls are not being rented. And that is a way that we can access funds to help us. Second, utilizing the facility. I wanted to share with you some news that we just learned this week. Like many of your halls, our cultural center is being shut down for several months. And faced with the concern that the individuals that were there may need to get let go, because as of 4 weeks ago, there were no bookings for 2021. And through the work and quick thinking of our staff there, we became aware that Halton was looking for vaccination centers. Halton visited us, and we were selected as a vaccination center for 6 months starting March 1st. And part of the reason that they selected the cultural center, in addition to the building, the parking, and all of those facilities, was the awareness and the processes our team had in place to deal with COVID. And in particular, they really appreciated the fogging units we had, because then they had confidence that if they held things there, the people running the facility respect safety and have the tools and the knowledge to keep people safe. So this very much can be
Again, we are, due to the high volume of internet usage, we're facing some technical difficulties. At this point of time, I'll contact Ivan and ask him to relog in again. Okay, hi. Slava Isusu Christu. I just wanted to thank everybody for watching, and once again, I'll contact Ivan to finish his conversation, because I see that there's lots of really good comments, and there's also lots of good questions too. Let me just call him. Okay. Ivana. Sorry, somehow you were booted out. Okay.
so. Was I talking to myself?
No, that's perfect. We have received a lot of good comments, by the way.
Okay.
Some additional comments and Connie had been given like lots of useful information in here as well. So we will go through some of the questions, if you don't mind, and then we had viewers from all over the country, from BC, from Calgary, from Ottawa, from the rest of Ontario. There's some feedback, and it's great that Ivan, I'm really grateful to you for doing that presentation. If somebody wants to receive their copy of the presentation or watch the presentation itself, it's on our YouTube and Facebook. And copy of the presentation is I can send it to you. So please email me directly. I'll be more than happy to send it to you.
I'll put together a PDF file, and then you can do
Ivan, if you can just move a camera a little bit more, center it to. Oh, okay, perfect. Now it's perfect. Thank you.
Yeah. I was hearing some echoing, and I'm trying to figure that out.
Okay. There's a echo there too, so might be because there's a feedback. Again, Friday nights. I know we like to get together on Friday nights we had a pastoral meetings on Friday nights as well, but it's very busy internet, and I live in a part of town where we do not have the fiber optics. We just have a regular telephone cable. So sometimes it doesn't work as the best we wanted to do. There's a couple questions, Ivana, that I just wanted to address here. That is, Christa has asked question that how can you keep up with all the information, wording, sciences that is changing constantly? It's overwhelming for lay people.
So that definitely is a challenge. And I'm sorry about the, I don't know what, let me turn this down. So there's no reason that every church necessarily needs to follow every piece of regulation. I prepare a weekly update on changes, regulations, as well as potential impact on our churches. And I'm more than happy to share that information with an individual from each church to use. And hopefully that will direct you to where you can easily get information and apply it in your own particular circumstance. I can't hear you.
Well, that's because I muted my mic.
Okay.
No, I wanted to just kind of address here a couple other things. Connie had sent quite a bit of good information, also the links. I do believe that she sent the link towards where can we get the additional information on grants that can help the churches and non-for-profits when he talked about the government. There's one comment that she had made, and I wanted to share this. The number two is that I have well, behavioral economics are the way to change behavior. Has non has non-compliance for mask wearing or social distancing been addressed? For example, require an extra donation required to go to an awareness class. And what's your experience, Ivana, about this non-compliance and stuff?
Within the church, it doesn't happen often. And we try to reason with it. Um, I'm not sure that they would be receptive to a donation. I think we found success in trying to encourage them, help them understand why it's important, and what they could face if they don't do it. There are fines from the public health authority. They put at risk our ability to keep the church open, and that's the approach that we've tried.
So basically, to more on educational side.
We don't want to confront people. We want to encourage them, help them understand why it's important.
Yeah. Okay. So there's also another question here. I have a few questions. What human social controls are in place / working to help people change their habits, beliefs, and actions? Uh, so what human / or social controls are in place or working to help people change their habits, beliefs, and actions? Uh, that is a very complex question. Yeah. That's right. We just had a talk about this last night with Father Ihor Kutash, who's a professor of ethics at St. Andrew's College. It's that bartering relationship with God. God, I'll give you this and you'll do that for me. I believe in you, therefore you protect me and stuff like that. So it's like one-to-one type of thing. I give you, you give me back. It's an opportunity to control God. Doesn't work that way. Unfortunately, in church, we need to do our part to the best of our ability to help others. Connie also had shared this site. Actually, right now it's on the screen. It's called grantwatch.com, and there's a faith-based grants as well. Some dollars perhaps could be found there as well. So maybe we can. It's right there. It's on the screen. Okay, and I do believe that I need to that we almost are finished. Okay. Okay, so uh, oh, it says we can't hear Ivan. Well, it was it's Angie saying that so that we have lost audio. Uh, okay,
Can you hear me?
I can hear you, but it's kind of scrambled voice. So perhaps it's
How
a
about
signal.
now?
A signal to me, perhaps that I probably should not torture you, Ivana, for much longer, and wanted to say thank you for your kind consideration. It was truly wonderful, educational, and very enlightening as a conversation today about this topic. I'm quite confident it is to be continued because it's ever changing, and every day something new, some new information appears, and people who are professionals in their field are needed, especially now, to kind of help guide through that treacherous undercurrents and landscapes, like the dangerous landscapes that are appearing. Because you try to do your best, but sometimes common sense just not enough, so some knowledge of regulations and rules come into play as well. Krista had mentioned at the end that she would like to do the Zoom call with Ivan, Connie, and anyone else who wants to see how we can reshape the government of Canada's response to religious institutions during the COVID-19, or whatever else happens. Well, it is not up to me. It's up to Ivan to decide whether he has time, because Ivan is heavily volunteering for the churches in Toronto area, and for Cathedral, and also for the St. Vladimir Center in Oakville. So lots of those policies that have been put together in those places are because of his effort and his hard work. So we want to thank you very much, and I just wanted to, if anything, to assure you that I will contact you to ask another advice and more questions, as I had before. So
Well, thanks for everyone's attention. And if there are questions, uh, some of the important links where you can access information, I'm more than happy to share. So please direct your questions through a text or directly to me.
yeah, and Ivana, you had mentioned about the presentation. I can share that presentation that you sent me with other people, or
Let me put a PDF together. There are a couple of errors I want to correct, and then
okay,
everyone can can share with them.
Окей. Добре, Іване, дуже дякую. Дякую всім, що дивилися, і ми закінчимо молитвою тоді. Добре? В ім'я Отця і Сина Святого Духа. Амінь. В ім'я Отця і Сина Святого Духа. Амінь. В ім'я Отця і Сина Святого Духа. Амінь. Богородиця Діва, радуйся, благодатна Марія, Господь з тобою. Благословена ти між жонами, благословений плід утроби твоєї, бо ти породила Христа, Спаса душ наших. Слава Отцю і Сину Святому Духу, нині повсякчас, на віки вічні. Амінь. Господи, прийди, благослови нас, даруй нам здоров'я, радість і Твоє благословення кожного нашого життя. Дякую, Іване, ще раз вам за те, що ви сьогодні представляли цю інформацію. Дякую всім, хто мав нагоду подивитися. Слава Ісусу Христу! І хотів також сказати, що наступного тижня в четвер буде зустріч через інтернет наш Montreal Ottawa Mission District, а наступну п'ятницю ми будемо говорити якраз про з отцем доктором Романом Рицарем. Ми будемо говорити про психологічні і так само про богословські, не богословські, вибачте, а духовні проблеми для тих, хто якраз хворіє addiction to pornography, basically. So we will have to talk about this next Friday night. Oh, Ivana, you're back. Ivan is back. Ivan disappeared for a while. Now he's back. So no, just next week we're going to have a conversation with Dr. Roman Ritzer about psychological and spiritual problems related with addiction to pornography. He is a researcher in that field. He had fantastic presentation at the Sheptytsky Institute in Toronto, and I just wanted to invite him and kind of do the shorter version of that lecture to our viewers. It's a very interesting topic to discuss and to talk, and of course you always are welcome to ask questions. Це все, що я хотів сказати.